Hi, everyone. My name is Henry Wong. I'm with Business Impact Northwest. Welcome to today's business expert session on small business benefits 101. So today on this webinar, we have Katie Stewart with Professional Benefit Services Incorporated. Katie has 12 years of experience consulting businesses on their employee benefit programs. And for the past 5 years, Katie has focused on helping startup businesses build comprehensive benefit packages to recruit and retain employees. And she's done everything from single location with a few employees all the way to multi-state organizations with hundreds of employees. And all the participants have been put on mute, but if you have any questions as we go along, feel free to type them in the chat window, or you can submit them in the Q&A, and there'll be some time at the end where Katie could go over any questions. So right now, I'll pass it over to you, Katie.
All right, sorry, we had a muting issue there. Hello, everybody. Good morning. My name is Katie Stewart, and as you just heard, I will be going through small business benefits and how it all works. So if anybody has questions along the way, please feel free to type them into the chat. I will address them all at the end. All right, so let's get started. First, as you heard, my name is Katie. I have 12 years of experience with employee benefits. That includes all the different pieces of managing benefits, such as implementation, renewal negotiations, account management. I've dealt with customer service, COBRA administration, and most importantly these days, compliance. So I do tend to focus on startup businesses. I really love the excitement of getting new benefits programs up and running for companies that are just getting off the ground. And we are also a sponsor of the Seattle HR Collective meetup. So for any of you out there that are in the HR role, the meetup that is hosted, it's once a month in the Seattle area, and it is a very great experience, a lot of wonderful HR people and great topics. So if that's something that you're interested in, I highly recommend checking it out. So the agenda for today, first we'll go over the basics of health insurance and the different routes to accessing it. We'll talk about the qualifications and retirements or requirements for group benefits, and then go through some steps and timelines of setting up a benefit package, and then also the basics of administering that benefit program. Then we'll get into some of the Affordable Care Act rules and how it impacts small businesses. And last but not least, we'll chat real quick about the role a broker can play in all of this. So without further ado, let's start with the basics of health insurance and the different routes to access it. So health insurance began back in the 1920s and originated with individual hospitals offering services on a prepaid basis. This led to the beginning of insurance carriers in the 1930s. Health insurance itself is an arrangement with an insurance company that is there to help protect people from high-cost health care. So basically, health insurance carriers are going out to different providers and setting up contracts to make sure that their rates that they charge for different health services are fair. It works by spreading the cost of care across large groups of people, distributing the financial risk. And it also allows for access to a larger network of physicians and more healthcare services, all wrapped within that insurance carrier and those contracts. The different routes to purchasing insurance. First, there's individual health insurance. This is where you can buy your own personal plan through the Washington Health Plan Finder, or the Washington Exchange is how some people call it. This allows for subsidized premiums based on income, and also gives people access to Medicaid, which is free or very low cost coverage based on your income. This is often referred to in Washington as Apple Health. The other route of purchasing insurance is buying it on the employer-sponsored level. You can either buy it directly through an insurance carrier, and here you get set community rates, which is based on the overall risk of the community enrolled with that insurance carrier, and then also flexibility on plan parameters, such as employer contribution amounts and the number of plans you can offer. There's also access to group-based insurance plans through associations or trusts, often referred to as association health plans. Here you can get negotiating power on rates, as well as bundled benefit enhancements such as life insurance and employee assistance programs. And I'll go over this in a little bit more detail here. So what is an association health plan? An association health plan is a type of health plan that is sponsored by a trust or association that has brought together a group of employers in the same industry or regional location. A common example that I often use is the Chamber of Commerce. So the Chamber of Commerce, also known as the association, partners with an insurance carrier to offer insurance coverage to the members of that chamber. The insurance carrier then looks at those members as the quote-unquote employees of the chamber, which ultimately creates a large employer. Previously, association health plans were required to be specific to an industry, such as technology or healthcare. On June 19th, 2018, so just a few months ago, the Department of Labor made it easier for association health plans to form, which are going to relax those rules on common industry and now allow association health plans to offer coverage to businesses within a common area. To be honest, this isn't very different in Washington State with these new relaxed rules. We do have many different association health plans already in play. They've been pretty popular in our area for years. And for 2019, we're not seeing too big of an impact on this new ruling, mostly because I think that the change was made late enough in 2018 that the insurance carriers didn't have time to add any additional association health plans for 2019. But I do imagine that there will be some added carriers or associations in 2020, which ultimately is a good thing just because it brings in more competition as well as more options for employers. So employer-sponsored group insurance, going direct versus going through an association health plan. So the pros and cons of buying direct with an insurance carrier. First, the pros are you have flexibility with employer contribution. And the employer contribution is the amount that you as the employer pay towards your employee's premium, so your contribution amount. Most carriers direct will allow employers to go down to 50% of that cost. It used to be common that 75% was the minimum, but now as healthcare costs are continuously going up, we're starting to see the insurance carriers drop that down to 50%. Another pro with going direct is going to be most carriers allow you to offer multiple plans side by side with limited restrictions. For example, Regence Blue Shield in Washington allows you to offer 5 different plans side by side, and you do not have to have any enrollment on those plans in order to offer them. So this really allows you to offer, the marketplace concept of plans to your employees and gives you and your employees flexibility to, one, you can choose the plan that fits within your budget to offer benefits, and 2, allows your employee access to buy up to plans that might fit their health needs more than the one that you as an employer can afford. It also allows a group plan down to 1 enrolled W-2 employee. I know there's a common misconception out there that you have to have multiple employees in order to offer group benefits. Ultimately, as long as you have 1 W-2 employee that enrolls on the plan, you are eligible to offer a group plan. They also offer 12-month contracts when you buy direct with an insurance carrier. I'll chat in just a couple minutes about with association health plans, often those contracts can be shorter because they require the association to renew all of their plans at the same time. But when you buy direct with an insurance carrier, you do get a 12-month contract. And then they also include pediatric, dental, and vision benefits, which is one of the 10 essential health benefits that's required on all small group plans now with healthcare reform. Some of the cons of going direct with an insurance carrier. First, they have community rated rates with no negotiating power. So basically, they're taking your average age of your group and the zip codes in which you reside and work, and that is how they're going to determine what your pricing is. There is no negotiating with competitive options with other carriers. There is no negotiating. So ultimately, that rate is the rate. Most of the direct carriers don't offer any bundled benefit enhancements like life insurance or employee assistance programs. And then last is their rating model when you buy direct. There is basically 2 different ways you can go. One, you can go the 2-tier rating model where they break it into 2 age brackets. There's age 0 to 20 and age 21 plus. Or you can get individual age banded rates, meaning you have one rate for those that are age 0 to 15, and then age 16 and up has its own separate rate for every age, which ultimately can cause for some administrative frustration. They also charge for each child up to the first 3 children. So if you have an employee that has multiple children, that can begin to add up as you're paying for each of those children. Some of the pros and cons of buying through an association health plan. The pros, you have large group rate negotiating power. So back to that Chamber of Commerce example, if you look at the chamber as the overall employer, they're going to have thousands of employees that are going to be the employees of each of their members. So when they go to the insurance carrier to create their products and their pricing, they have that large group negotiation availability. So when you go in to apply for or quote with an association, they can take more factors into play when looking at your pricing. They can look at age, and they can look at gender. They can also look at the risk level of your profession. So for example, in technology, often you'll see a lot of technology companies can get very good rates through association health plans, because in the technology industry, obviously they're sitting at a computer, they're not out doing anything that's high risk. So from an insurance carrier's perspective, they're a lower risk demographic. Another pro is that there's enhanced plan designs available that are no longer available on the small group market. The small group market has been quite a bit more regulated and is also more cost sensitive. So there's been multiple different parts of insurance plans that have been slimmed down quite a bit, whereas with association health plans, you're still seeing those large group plan designs. So you'll notice that in some scenarios, those plans can be a little bit richer than the small group market. Bundled plan enhancements such as life insurance and employee assistance program. So usually when you're buying through an association, there's $15,000 of life insurance or more that's automatically built into that medical plan. And then an employee assistance program, which is ultimately just a nice concierge service to help your employees through different life experiences and help them find in-network providers. It's just a added benefit that is a nice bonus that you'll see with the associations. Another is ability to bundle all benefits under one billing administrator. So you might have your medical, dental, and vision insurance all through the same association. It'll all be with different insurance carriers, but because the association manages all of it, you have one administrator that's going to bill you for each of those different lines of insurance. So it just makes it a little bit easier to manage from the payroll deduction and billing standpoint. And then also access to COBRA for groups with less than 20 enrolled employees. So COBRA is the extension of coverage for an employee that is no longer eligible or leaves the company. And it allows them access to anywhere from 18 up to 36 months of extended coverage on the same plan that you're offering your employees, and it's at their expense. So usually on the small group market, if you have less than 20 employees, you do not qualify for COBRA. But with this association health plan, again, they're looking at the association as the employer. So the Chamber of Commerce example again, obviously quite a bit more than the 20 employee limit. So they're going to offer COBRA to the small groups that are members of that association health plan. Some of the cons are that they're not always competitive on price, as they can use more factors when determining rates. So obviously that is a pro and a con in this situation. Often we'll see an older demographic group might not have the best rates with association health plans. Same with groups that are heavy with young females, mostly because, again, the insurance carriers are looking at the overall risks, and young females tend to have babies, and therefore they're taking that into consideration when coming up with the pricing. So there's short contracts, as they must renew the entire association at the same time. As I mentioned earlier, the association is considered the group. So they might renew the association, let's say on January 1st. So all groups that enroll within that association health plan will have to renew their benefits on that same date of January 1st. So if you set your insurance plans up with them on July 1st, just know that obviously 6 months down the road, you're going to end up having to renew. So there isn't that 12-month contract available. There's usually association dues in addition to your premiums. So to be a member of the Chamber of Commerce, for example, you'll need to pay your Chamber of Commerce dues in order to access it. So it's just kind of an added cost that usually you want to build in when considering your options. Then there's also a little bit less flexibility on the employer contribution amounts. Most association health plans still require you pay at least 75% of the employee's premium. And then the lack of flexibility on the number of insurance plans you can offer. Most associations will allow you to potentially offer up to 2 different plans, but they have minimum enrollment requirements. So usually you need to have 3 to 5 employees enroll on each of those plans. And then they also, uh, they just have minimum enrollment. So well, they have a matrix as well, meaning you need to make sure that you're finding plans that fall in with, they work together within their matrix. So if you want to offer a very high deductible plan alongside a very low deductible plan, oftentimes they will not allow those plans to be offered together. So they just have more restrictions. Okay, so on to qualifications and requirements for group benefits. So what is needed to qualify for a group benefit plan? First and foremost, a Washington State business license. So you do need to be based out of Washington State in order to offer Washington State-based benefits. You need at least one W-2 employee and at least 51% of your employees residing in Washington. Some carriers are flexible here if you hover right around that 51% mark. So, but if you have 10 employees in Oregon and 1 employee in Washington, you might run into some issues. But if you have 5 and 6, then usually we can work around that. If the owner is the only employee, they must be set up as a corporation or a subchapter corporation and be a W-2 employee of the business. That's one that we run into a lot. We have a lot of small employers with just themselves, just as the owner, that are trying to get a group plan put in place. And you have to make sure that you're set up as that corporation or subchapter corporation in order to have access. And then tax documents are often required for groups with less than 5 enrolling employees. And that does not include spouses and dependents. It's just the employee count that they're looking at. So if you have 4 employees or under, just be prepared to submit tax paper or tax documents along with the rest of your paperwork. For new businesses that have yet to file taxes, payroll records and W-4 forms may be required. And we run into this a lot as well, as many new businesses are trying to get a benefit program in place so that they can start recruiting employees in. So it is available, you just have to have the correct paperwork in order to make it move forward. Some of the important employer parameters to think about when considering implementing benefits. First is going to be your employer contribution. And again, the employer contribution is the amount that you as the employer are contributing towards your employee's premium. So again, depending on the insurance carrier, you are required to contribute at least, if you go direct with an insurance carrier, 50% for the majority of them. And that's part of the 50% of the employee's premium per month. With an association health plan, 75% of the employee premium is the common. There are a couple that go down to 50, but most again are at 75%. The employer is not required to contribute toward the spouse, domestic partner, or child premiums. That you can pass 100% of the cost on to your employee. And then if multiple plans are offered, the minimum contribution can be based on the lowest cost plan, which again gives you that complete flexibility to say, hey, my budget is this. Here is, let's say, a $5,000 deductible plan that falls perfectly within that budget. Now I know I can at least get a benefit program up and running. And then you can add those additional plans alongside that. So if you wanted a $1,000 deductible, a $500 deductible, an HSA plan, you can put all of those into one benefit package and allow your employees to pick and choose between those plans available, but know that your set cost is going to be based on that $5,000 deductible plan that falls within your budget. The next is employee eligibility, and this is when your employees are able to enroll on your benefits. You have quite a bit of control over this. So you get to choose when the employee is eligible to join. You get to specify the number of hours your employee must work to be eligible, and that can be from anywhere from 20 to 40. And quick note that if you have 50 or more employees, that pushes you up into the large group market, and you have to offer benefits to employees working 30 hours or more, so you can't go up to the 40 limit. You're also able to specify the number of days or months that the employee must work for you before they're eligible for benefits. This is known as your wait period. The options these days are the first of the month following your date of hire, first of the month following 30 days, first following 60 days, not to exceed 90 days. And then in some scenarios, the insurance carriers will allow you to choose your exact date of hire or the 90th day following your hire date. And the reason that these are strict now is the healthcare reform put in a rule that says you're not allowed to exceed 90 days for the wait period. So. And then the last piece to really consider is the employee participation requirement. So this is the number of employees that you have enrolling on your plan. So most insurance carriers require at least 75% of your eligible employees enroll on your benefits. And the eligible employee is the key word here. So an eligible employee is someone that works the required minimum hours that you've preset, has satisfied the eligibility wait period, again, that you've preset, and then does not have other group-based coverage. So usually that's going to be through a spouse or a parent's employer. If somebody has individual medical insurance, they are considered eligible and will count towards that 75%. So if you are not able to get 75% of those eligible employees to enroll on your benefit, then that plan will not be available. That's something that I know many employers tend to worry about, but to be honest, we very rarely see a group that doesn't meet participation. There is no minimum eligibility for spouses, domestic partners, or children. You do not need to force any employees to enroll any of their family members. That is completely up to them. Now we're going to move on to the steps and timeline to set up a benefit package. Step one is going to be quoting. So, and this is, coming from the broker's perspective as somebody that goes through these steps every month. So obviously these timelines can vary a little bit, but these are usually what we like to stick within in our brokerage. So at approximately 60 days out, the first step you want to do is researching is to obtain quotes for all the available different insurance carriers. To do this, you usually need to provide the following information. First is going to be a census of your employees, which usually includes their name, gender, date of birth, date of hire, and any enrolling spouse and dependents' dates of birth and zip code. And the dates of birth are going to be very important because that's ultimately where the insurance carriers are basing their rates on. So they're going to take that average age, both for the employee and any spouses and dependents that enroll, and they're going to base the rate pretty heavily on that piece. So making sure that you have that information as accurate as possible is really important, because when you enroll, if it changes at all, those final rates based on your final enrollment will most likely change along with it. If you have current benefits in place, often the insurance carriers will want to know what your current and renewal rates are, along with a plan summary of your current insurance, so that they can get an idea of where they fall to see if they're competitive, and also get an idea of what your risk level may be based on what your current insurance is charging. Step two is going to be review your options, which at approximately 45 days out, you want to be doing this piece. Usually takes 5 to 7 business days to collect quotes back. And then once you've received, there are many different variables to consider. First, obviously, is price point, and trying to compare each carrier to see where they fall within the price point of similar plan design. So if you're looking at $1,000 deductible plans across each carrier, how much do they vary in cost? The next is going to be the plan designs for each of those, because each insurance carrier, although the plans are very similar, they each have their own special tweaks and different ways to cover different services. Provider network is another important piece to consider these days, as a lot of insurance carriers are starting to slim down their networks. Some carriers have specific provider networks where you have to go within a specific hospital group. UW Medical, for example, is a common one in Seattle. And then there are also some insurance carriers that have networks that have lost some of the big providers. For example, Primera has their Prime network, which no longer includes Swedish, which in the Seattle area is very important. So it's just good to know what those different networks include and don't include when you're reviewing your different options. Also, the option to offer a single plan versus multiple plans. Some carriers won't allow multiple plans, while as others definitely do, like Regions I mentioned will allow you to do up to 5. United Healthcare allows you to do 10 or more. Primera allows you to do 2, I believe. So it varies across each carrier. So having an idea of whether that's an important piece when you're looking at putting your benefits program in place is good to know when you're reviewing your options. Also, the cost to your employees for their family. We're all very focused on what the employee premium is, but when it comes to offering that benefit to your employee, their premium may be heavily subsidized by you as the employer, but they usually are having to pick up the cost, the full cost for their spouse and dependents. So having an idea of what those costs are going to look like for your employees ahead of time when you're reviewing is important. And that again brings in the benefit of having that multi-plan option, because if you can offer a cheaper plan, employees may be more likely to enroll on that with their families since it's more affordable. And then including dental, vision, life, or disability is another piece you'll want to consider as well. Some of these plans you can bundle in a dental plan. Some of them include a vision plan pre-built. So knowing which of those include those different added benefits is helpful. And then having a proposal of all plans laid out side by side is beneficial, so you can compare and contrast each option with the above points in mind. And this is one of the places where a broker is going to be extremely helpful, as that's kind of one of the main goals of a broker, is to be able to lay all those plans out so that you can compare it apples to apples and see, because some of them again may vary, their pricing might be very similar, but the plan design for one of them may be less desirable than the other. So being able to look at them side by side is always very helpful. Moving on to step 3, this is going to be your plan selection and announcement. You want to usually get this going about 30 days before your desired effective date. So the third step when implementing a benefit program is to choose the plans that are going to be offered to the employees, and then to host an employee benefit meeting. Hosting an employee benefit or an open enrollment meeting is very important, especially when implementing benefits for the first time. It provides your employees with a clear understanding of the benefits being offered, along with the associated costs for themselves and their family. This is especially important when multiple plans are being offered, again, so that they're able to determine which plan fits their health needs best, also their budget. Awareness of the paperwork that's needed to enroll or waive, and the deadline to return them by. And then familiarity with the person that's managing the benefits, whether that be your HR team, your broker. It's somebody that's there that they know that they can contact if they have questions on plan designs, pricing, the enrollment paperwork, and then even throughout the rest of the year, knowing that they have a go-to person that they can talk to about any insurance questions. Step 4 is enrollment and submission. And this is approximately 20 days before your desired effective date. So the fourth step when starting up your program is to gather and submit all paperwork to the insurance carriers. So the following paperwork is what you can expect from the employer. One, you'll need a master application stating your plan selection, participation, and the different employer parameters that we spoke about earlier. That includes your wait period, your eligibility, COBRA status, etc. Tax documents will be required if you have less than 5 employees enrolled. As mentioned earlier, obviously a copy of the Washington State business license. Usually you need a copy of your quarterly wage and tax statement, which breaks down all of your employees and how many hours they work per quarter. And then any employer filed tax returns, which those requirements vary based on your business structure. You can expect the following paperwork for your employees. An enrollment form with the employee and any enrolling spouse, domestic partner, or children information included. And then for those that choose not to enroll, you'll want to collect a waiver form, basically saying that they've declined their option of enrolling on insurance. And for those that are waiving due to other coverage, many of the insurance carriers require a copy of an ID card from their other carrier. The deadlines for paperwork begin on the 15th of the month prior to the month you want coverage. So for example, if you're looking to start benefits up December 1st, you can expect to have all paperwork in hand and submitted to the insurance carrier by November 15th. Step 5 is your approval and final rates. Hopefully we can get this done 10 days before the desired effective date. So the 5th step when finalizing your program is to approve the final rates and then inform your employees of any changes in cost. So once the insurance carrier has reviewed all submission materials, they will return their approval and final rates, or they'll let you know they need additional information to approve coverage. Another little plug for a broker here is usually if you have a broker involved, they're reviewing all of that paperwork for you before it hits the insurance carrier's desk, therefore catching any of the errors or missing items, and then you can address it before it gets held up on the insurance carrier side and ends up causing delays on getting people enrolled in coverage. Assuming they approve your group benefit plan and the employer approves the final rates, they'll begin installing the new plan, entering employees into the database, and activating coverage. At this point, you'll receive a group number for your insurance plans, confirmation that the employee ID cards are being mailed to their home address, and your first month billing statement will hit sometime after this as well. Note that there can be delays when it comes to the first billing statements, as they obviously need to get everybody entered into the database before they can generate the bill. So usually it's 2 to 4 weeks after your coverage begins that first month's bill comes through. And then step 6 is active coverage. Obviously, you want this to happen on 0 days before the desired effective date. So the 5th or 6th and final step is to let your employees know they're officially insured. So once insurance is active, your employees can see providers and use their new insurance. They also have access to many helpful benefit tools. First is the insurance carrier's web portals, where they can view temporary ID cards, and these are printable just in case somebody were to lose their card. Your insurance plan booklet and plan summaries are on there. There's also claims data available where you can track your different providers and the services you've had. You can check your deductible and out-of-pocket maximums. Cost comparison for different medical services. For example, if you're going in for an MRI and you want to know what it costs to get an MRI at one provider versus another, most insurance carriers now have those cost calculators on their portals. You can also look up prescription drug costs, search for any in-network providers, and then you'll also be able to find all of the added benefits that are usually included in your insurance, such as gym membership discounts and healthy living discounts. There's tobacco cessation programs. There's a whole bunch of other little added extras that often get overlooked because people don't ever take the time to peruse the website. So I always recommend going in there and checking the portal. There's also mobile phone apps with access to electronic ID cards, and the majority of the information that you can find on the web, you can also find through your mobile app. And then some insurance carriers also have wellness incentive programs that employees can complete for points and or prizes. For example, Regents has a wellness discount program that allows once an employee completes a 2-step system, it's both a health questionnaire basically and then biometric screening. Once that's been completed, there is a 3% discount that's applied to the medical premiums, which is ultimately trickles down to the employer having some savings, and then the employee also gets a $100 gift card. So each of the different carriers kind of have their own wellness incentive based system. So I see that there is a question that came in. Just a quick reminder, as soon as I get through all of the slides, I will make sure to go through those questions. All right, so the basics of administering your benefits program. So once everything's up and running and you've gone through those 6 steps, the next thing is going to be managing it. So the first is going to be eligibility. So understanding your eligibility is one of the most important pieces when administering benefits. If the rules and timelines are not followed, an employee could potentially miss their opportunity to enroll and be required to wait months before they're eligible again, which could ultimately leave them uninsured, and obviously that would not be good. Employees are allowed to enroll on your insurance benefits in the following 3 different scenarios. The first scenario is going to be when they're initially eligible. So once they've been working the required amount of hours that you've previously set and the required amount of days or months, again, set by you, they're eligible to enroll on your benefits. If they have a qualifying event. So there are multiple life events that trigger qualifying events throughout the year. In the case of one of the events below, employees are eligible to enroll in most scenarios the first of the month following the event. So obviously, common one is marriage. If you get married, you're allowed to enroll your new spouse. If you have a baby or adopt a baby, you're allowed to enroll the new baby. The most common that we're going to see is going to be an involuntary loss of other coverage. And usually this is going to be if you're covered through a spouse's employer and that spouse leaves their job, you'll lose the insurance through their ex-employer, and therefore you have access to enroll on the new plan that is offered by your employer. And then another common one these days is when you age off your parents' plan. So healthcare reform now allows children up to age 26 to remain on their parents' insurance. So as soon as they turn 26, though, they're kicked off that insurance plan, and that gives them access to enroll onto their employer's plan. Again, the same concept of an involuntary loss of other coverage. And then the last time you're allowed to enroll is during open enrollment. So open enrollment happens each year at your contract renewal. So this provides employees that previously waived coverage access to come on insurance on the date the plan renews. They usually have the month prior to that to enroll on coverage. So again, if you were to set up a benefit plan December 1st and they chose not to enroll at this initial enrollment, their next access to enroll on coverage would be December 1st of 2019. And they'd have the month of November 2019 to choose to enroll on that December 1st plan. Enrolling and terminating employees, one of the big administrative pieces to managing a benefits program. In this case, deadlines are very important when enrolling and terminating employees, because if you miss a deadline, it could mean an employee misses their opportunity to get insurance, or it could be money out of your pocket for someone that no longer works for you. So when it comes to enrolling an employee, when an employee is eligible to enroll, you must provide them with either an enrollment form or a waiver form. You'll need to have them return one of those back to you. An enrollment form means obviously they'll enroll on benefits, and then a waiver form means that they've declined their option to enroll. You definitely want to keep a copy of a signed waiver on file, as it's the proof that you've offered them the coverage that they've been eligible for and that they have declined it. The enrollment form must be returned to either your broker if they manage your enrollments and terminations for you, or to the insurance carrier no later than 30 days after the qualified effective date. So if you have a new employee that's eligible to enroll on January 1st, you want to make sure that form is in the insurance carrier's hands to be processed no later than January 30th. If an employee waives coverage, most insurance carriers do not actually require a copy of that form. They just ask you to keep it in their file should any questions come up in the future. When it comes to terminating an employee, when an employee is no longer eligible for benefits, either they've left the company or they've reduced their hours down below your required amount, they need to be removed from insurance. Most insurance carriers require written notice of the employee's termination or drop in hours within 30 days. Their coverage will then end on the last day of the month of their termination or drop in hours. And it's very important that you notify them or notify the insurance carrier, because if you don't, you ultimately continue paying their premiums up until the insurance carrier has been told they've been terminated. And if you wait too long, unfortunately, the carrier will not reimburse you for the months that were overlooked. So then you end up paying premium dollars for somebody that is no longer working for you. A terminated employee will have access to extended coverage. The amount of time and the rules and regulations on the extended coverage vary based on your company size. So if you have 1 to 19 employees, unless you're with an association health plan, so assuming you're with an insurance carrier directly, state continuation will apply. It's also known as continuation of coverage. The amount of time the coverage can be extended ranges from 1 to 6 months, depending on the insurance carrier. Then if you have 20 or more employees, or if you're on an association health plan, COBRA will apply. COBRA is a heavily regulated and requires specific notices go out informing the employees of their option to continue coverage from anywhere between 18 to 36 months, depending on their situation. Payroll and billing is something we always like to tell our clients to make sure that they stay on top of. So once your benefits are set up and employees have elected their plans, you'll want to make sure that payroll deductions are in place and that your billing statements with the insurance carriers are correct. Here are a few tips to make sure you keep your premium side of benefits clean and accurate. First, you as the employer will be responsible for paying the insurance carriers each month. So you'll receive a bill for the premiums for every employee and their family members, and that you are paying to the insurance carrier. To reimburse yourself for the employee's portion of their cost, whether that be their percentage of their own employee premium along with their spouse dependent premiums, you're going to set up payroll deductions for each employee. The deductions should be set up as post-tax deductions unless you have a premium-only plan, which is a type of Section 125 plan, that allows you to do the premium deductions pre-tax. So if you use a payroll company, oftentimes they'll be able to set those premium-only plans up for you. Many of the different brokers out there will also put premium-only plans in place. Definitely a subject that you want to bring up when you're looking at implementing your benefits. You also want to keep an eye on your billing statements each month to make sure there are no errors. If an error is not caught soon enough, it could end up as additional cost to you. So some of the common errors we tend to see are forgetting to remove an employee and they remain on the bill. As I mentioned earlier, if you wait too long, the insurance carriers will not retroactively remove them, so you may end up having to pay a couple of months extra. Another one is if enrollment paperwork wasn't received, an employee was not added to insurance, they would not show up on your billing statement. So if you do have a new hire that you bring on, you want to make sure you check each month to see that they're on there, because if they're not on there, chances are they are not insured. And again, if you wait too long, it may go past that timeline of being allowed to add them back on. I know that there are often delays between membership and billing. So that means if you have any employees that are added or removed late enough in the billing cycle, it might not make it on time for that bill to be generated, and therefore it'll show up on the following statement. So just again, keeping an eye every month on your statements will help you keep on top of that. And then it's important that your insurance premiums are paid on time every month. If you do not pay your insurance, it could be terminated, which ultimately leaves your employees unexpectedly uninsured. And then worst scenario here is you as the employer could be held liable for any denied claims due to the unpaid premiums and canceled coverage. So again, staying on top of making sure those statements are paid each month is very important. And then another really helpful piece when it comes to administering your benefits is the education and resources side of it. So providing your employees with the tools they need to best understand and utilize their insurance is essential. If they do not have these tools or a basic education on the benefits being offered them, they may overlook the value of what you as the employer are providing. And as we all know, insurance is not cheap. So that's a clear large expense for most employers. So you want to make sure your employees can really get the value out of it. Here are some of the common resources that help employees best understand. First is going to be the Summary of Benefits and Coverage, or an SBC. You're actually required to provide these to your employees as one of the healthcare reform regulations. This is ultimately just a summary of your insurance plan that's written in an easier to understand format. And I put that in quotes because, to be honest, plan summaries are actually a little bit easier to understand than the SBCs usually, and they tend to contain more detailed information about the plan design. So we usually recommend employers hand out both a SBC and the carrier's detailed plan summary. That way, just getting as much information about their insurance as possible. Details on the insurance carrier's website is really helpful to hand that out to your employees or let them know that that's available. As mentioned earlier, they have online portals where you can look up your benefits and claims. You can also track your deductibles and out-of-pocket maximums. You can look up the costs for different services and your in-network providers, all of that. And the mobile app as well. So most insurance carriers now have a mobile app available. They're extremely helpful as they're often used as an electronic ID card. We tend to get quite a few emails of employees that have lost ID cards and are looking for new cards to be sent. The nice thing about these mobile apps is you'll always have your card on you as long as you have your phone on you. So You can also look up the same details on claims and benefits. And another really nice piece of the mobile app is the location-based provider search functionality. If you're traveling, even if that's locally in state or if it's out of state, you can use their web apps to find in-network providers based on your current location. So now we're going to move into the Affordable Care Act and how it impacts small businesses. So first, what is the Affordable Care Act? The Affordable Care Act, often referred to as Obamacare, was signed into law by President Obama on March 23, 2010. It was the biggest overhaul of the United States healthcare system since Medicare and Medicaid in 1965. The ACA requires most individuals to obtain health care coverage. It also requires insurance companies and employers to provide consumer protections related to health coverage, like covering pre-existing conditions and not charging more for coverage based on gender. The key elements of the ACA are the most popular is free preventive care. All qualified health plans are required to cover certain preventive care services at no cost. There's also the health insurance marketplaces, a new way to find health care coverage and compare options. It can also help if you don't have coverage now or if you have it but want to look at other options. And this is the marketplaces are where you can find those potential premium subsidies as well. And the Affordable Care Act Patients' Bill of Rights. The ACA offers new rights and protections that make coverage fair by not allowing insurance carriers to cancel or deny coverage due to health. It also requires that coverage be easier to understand, which was why the summary of benefits and coverage came into play. How does the ACA impact small businesses? So a small business is defined as a company with less than 50 full-time equivalents, or also known as FTEs, employees. It is important to note that this includes controlled groups as well. So a controlled group is a group of multiple businesses that have majority common ownership. We have multiple clients that fall into this realm, one of which actually has only 10 employees locally, but then has another 60 plus employees out of the country. They are considered a large group because of the fact that they have multiple employees and push them above that 50 mark. So many of the ACA laws impact the large group market. Again, 51 or more FTEs, but there are still some regulations that small employers must pay attention to. One of these is the employee wait period, which I mentioned this a little bit earlier. The ACA states that employers may not impose a wait period that exceeds 90 days. All eligible employees must be able to enroll on benefits within the first 90 days of becoming eligible. Dependent coverage up to age 26. Again, I mentioned this a little bit earlier as well. All insurance carriers and employers that offer plans to provide dependent coverage to children must make coverage available for adult children up to age 26, regardless of their student or marital status. And then the notice of the exchange. All employers are required to notify employees of their access to the healthcare exchanges. These notices should be handed out within 14 days of the employee's date of hire. And quick note that this applies to all employers, regardless of whether you're offering insurance benefits or not. And the Department of Labor actually has a couple of template documents that you can use for what this notice is. So if this is not something that you're already doing when you're bringing on new employees, you'll definitely want to hop onto the Department of Labor's website, search for those notice of exchange, and then start handing those notices out. And then again, the summary of benefits and coverage. All employers offering health insurance must provide their employees with this very specific format of an SBC, notifying them what their coverage looks like. And then 60-day notice of plan changes. This one is actually pretty significant. All insurance carriers must notify those enrolled on their plan of any changes within 60 days of that change. We run into this one a lot because the insurance carriers are pretty much making changes to their plans every year now because they have to keep up with the actuarial values and the different rules and regulations that healthcare reform has put in place to make sure that the plans stay affordable and of minimum value. So most people are getting these notices, especially if a plan is canceled. And so if insurance carriers make significant enough changes to their plans, they actually have to cancel one year's plan and start up a brand new plan for the following year. And when that happens, all employees and employers get a letter in the mail saying their plan has been discontinued. This is often misunderstood as their insurance is being canceled. That's not the case. The insurance carriers are always pushing you from the plan that's being discontinued onto the new plan that they've created to replace that. So it's not that you're being terminated off of insurance. It's just that, hey, there's a notice that this plan that you're currently on is no longer going to be available, but there is a new one that will be. There's also a small business tax credit. The Affordable Care Act amended the IRS code to create a tax credit for certain small employers that provide health coverage to their employees. It was designed to encourage small employers to offer health insurance. So to qualify for the tax credit, you must have fewer than 25 FTEs, pay an average of annual wages of less than $53,200, and this is the 2018 limit, per FTE. So the average between all of your employees must fall below that. And then pay at least 50% of employees' health insurance premiums. And again, this does not apply towards the spouse or dependent premiums. This is specific to the employee's premium. If you do meet those requirements and choose to offer benefits, you should consult with your CPA. They should be able to guide you on how to apply for the tax credit, what the tax credit will look like, and all of the other details. So how does the ACA impact the insurance carriers? Many of the changes brought on by the ACA fell in the hands of the insurance carriers. Many regulations were put in place to make insurance plans, or make sure insurance plans cover necessary services such as preventive care. Here are the main changes you'll see in the small group plans today. First is going to be the 10 essential health benefits. So every plan out there has to have these 10 essential benefits built in. So there's ambulatory patient services, such as outpatient surgery centers, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse, prescription drug coverage, rehabilitative and habilitative services, which are things such as physical therapy, massage therapy, speech therapy. And then you have lab services, preventive and wellness services, and pediatric services, which include dental and vision care. And to be honest, in Washington State, the majority of these items were already built into every medical plan. We have pretty strict rules in Washington that allows for very robust coverage. So the biggest change within that list was the pediatric dental and vision care, which now has to be bundled into every plan. Another big piece that the insurance carriers had to take on with healthcare reform is the addition of preventive care being covered in full. So most carriers already included an annual physical, but you still had to pay your copay for it. Once healthcare reform hit, they had to offer those preventive care visits at no cost. So there is no copay, there is no charge whatsoever for the services held within that preventive care visit. And these include things such as your annual physical, vaccinations, mammograms, colonoscopies, birth control falls in there, as well as STD screenings. There is a much larger list, and it's actually pretty specific to your gender and age. So all the recommended timelines of getting these different services, and every carrier now has a nice little list summarizing what those are. Annual limits was another change. Insurance carriers are no longer allowed to put annual or lifetime limits on those 10 essential health benefits. This is definitely a positive change, as before they could basically say, hey, we'll cover only this amount of this, and then you're responsible for everything after that. Now they have to cover it continuously. There is no limit. A big one was mental health. They used to have visit limits for mental health, and now there are no visit limits whatsoever. They cannot limit it at all. And then there's limits on cost sharing. So group medical plans are subject to limits on cost sharing known as your out-of-pocket maximum. So in 2018, your out-of-pocket maximum cap that they have in place right now is $7,350. In 2019, that's going to bump up to $7,900. And ultimately, what your out-of-pocket maximum is, as I always call it, your worst case scenario number. It's the most that you'll pay in a calendar year towards medical services. And that, mind you, is separate from your premium. So that's just for actual medical services rendered. So they cap that out again for 2018 at $7,350, and it'll bump up to that $7,900 in 2019. So the ACA requirements that do not apply to small businesses, these are probably some of the more common ones that you've heard in the news. Many of the requirements laid out by the ACA were built with larger businesses in mind. Because of this, there's multiple regulations that do not apply to small businesses. Again, those with the 50 FTEs. Here are a few of the requirements that apply only to large businesses. So when there's W-2 reporting, so employers with 250 or more employees must disclose the aggregate cost of employer-sponsored coverage provided to employees on their W-2 forms. The big one is the employer penalty. So the ACA requires that employers with 50 FTEs or more offer insurance to their employees. If they do not offer affordable minimum value health coverage, they'll be subject to penalties if any of their employees receive a subsidy for health insurance through the individual medical exchange. This decision to offer coverage or risk the penalty is often referred to as the pay or play rule. And if you have 50 or more employees, chances are, and you're not offering an employer-sponsored insurance plan, chances are you're going to have at least one of those employees that's going to go purchase insurance through the individual market and qualify for one of their subsidies. So the chances of the penalty hitting are pretty likely. There's also Section 6055 and 6056 reporting. The requires that all employers with 50 FTEs or more report information to the IRS and their full-time employees regarding their health coverage. This information is submitted via these forms 6055 and 6056. And then the hour requirements for full-time status. So the ACA defines a full-time employee as anyone working 30 hours or more a week. So all employers are considered a large, or all employers that are considered a large group with those 50 FTEs or more must offer benefits to all full-time employees working 30 hours or more per week or face the employer penalty. All right, and on to our last section. So what role does a broker play? Insurance brokers are independent from the insurance carriers, and because of this, they can provide unbiased information from multiple different insurance carriers and associations. This allows you the opportunity to compare and contrast each option and consult on how it will best work for your business. You know, I brought this up a little bit earlier as well when we were talking about quoting and being able to compare your plans side by side and apples to apples. So definitely one of the big benefits of having a broker in there is somebody that is able to lay those out for you and show you how the plans all look next to each other. Some insurance carriers and most associations will only offer quotes to licensed insurance brokers, meaning working with a broker allows you access to the full selection of insurance carriers and plans available. Whereas if you try and go direct, you might run into some roadblocks. Insurance brokers are experienced with different insurance carrier networks, the plan designs, and the fine print. So this allows them the ability to truly evaluate how each option works for you and your employees. And then insurance brokers offer a variety of additional services beyond just quoting and evaluating the options. Each insurance brokerage has their own list of services, and they tend to vary a little bit here and there, but most of them are going to include the following. That's going to be insight on the insurance market and plan benchmarking to make sure that the insurance plan you're offering is in line with some of your competitors. There's also enrollment and termination assistance, which, as I spoke to earlier, when it comes to eligibility and making sure your billing and everything is up to date, having somebody in there to help make sure that those enrollment forms have been received, make sure the terminations have been processed can be very beneficial. Customer service for claims and billing, and this applies to both you as the employer and to your employees as well. So if you're, as the employer, having issues with billing or somebody's showing up on the bill that shouldn't be there, you can work through a broker to help resolve those issues. And the same goes with an employee that had services done, feels like the insurance didn't cover it correctly, or maybe it was a denied claim. The employee can call the broker for help reviewing all of that as well. Compliance tracking and updates are a huge one these days. There's so many different regulations in play. Having somebody to make sure that you're staying compliant and on top of things in case of a potential audit is really helpful. And then employee benefit education through meetings, lunch and learns, and one-on-one counseling, another very nice service that a brokerage would offer. And then last but not least is going to be the benefits renewal, review, and negotiation. And that's something that has to happen every year. So having somebody that you can pass that responsibility off to while you're trying to run your business is another major value of having a broker. So with that, that is the end of the webinar, and I want to thank you all for joining. Let me go in here and see. I've got one Q&A. Yes, somebody asked if the meeting is being, and the slides will be available after the fact. They will. And I will see if I can get Henry to kind of elaborate on how that will work. And then as for, let me go into the chat here and see what we have. How are brokers compensated? So brokers are actually compensated in most scenarios by the insurance carriers. So the premiums, when you quote an insurance plan, the premiums usually have broker commissions built into that. So you don't have to worry about paying a broker and the insurance carriers. In some cases, we're starting to see it more common for what are called micro groups. So for those groups that have the less than 5 employees enrolled, kind of it goes in line with when you're going to have to provide tax documents to qualify for benefits. We're starting to see some brokers charge for groups of that size, just a small annual fee. And again, it will range. Every brokerage kind of has their own internal process for how that works. So it definitely doesn't hurt to ask, though, when you are speaking with a broker. And at this point, that is all the questions that I show on here.
Yeah, and just to go back to Katie's question, this is being recorded, so there will be the slides and recording of this webinar will be available to you all. So I think you'll get in a follow-up email, or I'll definitely reach out to the people that requested that.
Perfect. All right. Well, thank you again, everybody, for being here. All of my contact information is on this last slide as well. So if you have any questions and want to contact me directly, please do not hesitate to do so.
Okay, and we can leave the screen up for the next couple minutes in case you need to jot down any information. But other than that, feel free to disconnect on your phone or however you're watching the presentation.
Wonderful. Thank you again, everybody.
Thanks, Katie.
Yes, have a good day.